topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Good afternoon, Dallas-Fort Worth. Welcome to another Ask the Expert show the day before Thanksgiving. And we're here giving you a live show. I am so excited about this show. We have been doing a survey for the last 3 months on all 50 of our shows. And the show we're getting ready to do right now is our third, she doesn't even know this yet, our third highest rated show. And we want to welcome Dr. Gamboa.
Oh, wow. Thank you, Steve. Nice to hear that. I didn't even know that.
I got to tell you, our highest one has actually been with us for 10 years, and they do 3 shows a month. So I don't even know if that counts, but you were number 3 out of our 50 shows.
Wow.
People love how you explain things.
Oh, thank you.
And I got to tell you, I'm going to give you a kudos for something, because we're getting calls here, people who want to start using you as a doctor, mostly all female, but your practice isn't going to, I guess, be available for new patients until January.
That's
and
cool.
I want to tell you, most doctors, you know what they would do? They would take in as many patients as they can and not give everybody their full attention. And not Dr. Gamboa. You want to make sure everybody gets your full attention.
Yes, thank you, Steve. And that's the goal, that's also why I decided to do what I do, because it's like personalized care. So it's only me in the office. So I try as much as I can to do that. But if I overextend myself, then I'm not going to be able to give the attention. And sometimes I'm feeling that with my older patients that they were in the practice. So I have to a little bit scale down and put a pause. And then again, if I can find help or something, but that's the idea. I want to be the one taking care of my patients, but at the same time, I don't want to get burned out or die in the process, So that's why I have to.
That won't do anybody any good.
Yes, exactly. So I have to try to balance things out. And thank you for the patients that are willing to wait for me to see them in January.
Absolutely.
So it's
they love you, Dr. Gamboa.
It's only me in the office, so that's what it's going to happen.
So the name of your clinic is Elite Care. Tell everybody about your clinic.
Yes, it's Elite Care Clinic. We are here in Las Colinas. I am a family medicine doctor, but I also do a lot of functional medicine. I do a hormone replacement, and then also I do weight loss. I'm diplomat of the American Board of Obesity. And I'll also do some cosmetics, I'm doing rejuvenation. I have lasers. I have the microneedling. So because I wanted to do well from inside and out, healthy and also look good, feel good. So the whole package. So then that everything is taken care of.
We just got our first text from Janet in Plano. She wants to know, what hormones do you test for women?
Thanks for the question, Jenna. So we test for estradiol, that's your estrogen, the progesterone, the testosterone, which is so important. And for the longest, they were only thinking that that's a male hormone, and many societies still think that women do not need the replacement of testosterone. So they're not endorsing it yet. But we've been replacing testosterone, which is vital for our body, our mind, our bones, our energy. So the two hormones that are most important for your energy and for your mood are testosterone and thyroid. So I also check thyroid, but I also check the functional part of your thyroid. I make sure that you don't have antibodies against your thyroid, which are the ones we call it Hashimoto thyroiditis. It's whenever your own body is attacking your thyroid. And later on, your thyroid is going to become a little ill and it's not going to produce enough hormones. So we check for all those things.
Okay, this is from John in Irving. That's really close to you. Uh, he said, "My wife and I watch your show every month, and we really enjoy it. I got to ask you, you keep saying that stress is the cause of weight gain. How do you treat stress in your practice?"
So that's a great question. So stress, what does stress do? It increases your cortisol. Cortisol is a stress hormone. So cortisol is going to be like doing all the problems. It's going to increase your insulin resistance. It's going to shut down your thyroid. It's going to make your like a lymph, your white blood cell count, like your natural killer cells not function as well. So you're going to get sicker more often. So like, how do I treat it? So like, definitely there are like many things that we do. We have to check if you are already insulin resistant. We're going to help you with supplements. There's like excellent supplements that are natural, that they decrease your cortisol production. And of course, like we have to also help you with exercise, eating healthier, like and breathing techniques. There's like box breathing. That's a very excellent technique that also brings down all this cortisol that a lot of the times if you're at work, if you're stressed out. So if you do this box breathing exercises throughout the day, then little by little it comes down, because also cortisol is going to bring your blood pressure up. So it's the culprit for everything, but we do many different things to help you, and some of them are supplements.
So, what about how important is sleep?
Oh my goodness, thanks for bringing that up, Stephen. Like sleep is one of the most important things. Remember how like the beauty sleep is like 8 hours? Like basically, yes,
Yes.
that is true,
Is that
because
true? Is 8 hours true?
8 hours would be ideal, but if you think about it, like many people has two jobs. Many people has like night shift. Many people like only sleep 4 or 5 hours a day. And that's what causes even drives the stress hormone higher, the cortisol levels higher. So then you have more insulin resistance, then you have more cravings. And not only that, whenever you don't sleep well, regardless of just your shifts or your work, or because you have obstructive sleep apnea, then that is not treated, then your hunger hormone goes up. So everything is a vicious circle. Everything is related. So you don't sleep well, your hunger hormone goes up, your cortisol levels go up. So then your insulin resistance. So everything is like a ball of like um, snowball effect.
Everything is related.
Yes.
Before we get to this next question, I can't believe it took 3 questions to start talking about the skinny injection. But Dr. Gamboa, I heard some really maybe good news today that with the new administration, we have all these new health people coming in,
Mm-hmm.
and they're going to try to get uh, I think they said 3 or 4 of the skinny injection of those approved by Medicare and Medicaid.
Yes. So
Wouldn't that be something?
that is great. But Stephen, like the fine print of that is that yes, they're covering it, but they're only covering it right now for those patients that already had a cardiovascular disease, meaning a heart attack, a stroke. Those are the only ones that are going to cover. Yes, it's something, but shouldn't it be like more broader, like indications, like the FDA said? Yes, like the Wegovy, the Monjaro, like especially Wegovy. That's the one that has the indication for prevention of strokes and cardiovascular disease. But they did that to expand the indications. They didn't that to narrow the indications. So now the insurance companies are taking that to only say, okay, we're going to cover it, but it's going to be only for this little bitty patients that we have that they already had. I mean, we're trying to use these medications to prevent these problems, to start with, but they are not getting that. So hopefully at some point, because I heard something make America healthy again. So that would be great to make America healthy again. Yes, but we have to help people with obesity, with overweight to become like and to go into their healthy weight so that they don't have all these other problems. They don't develop obstructive sleep apnea. I keep reading that finally now they're saying, oh yeah, like this GLP-1s, that's the skin injections, are good for people that they have obstructive sleep apnea. Of course, we already knew that, but finally
Yes.
they're saying it. Oh, the GLP-1s are great for people that have kidney disease. Great, yay, we knew that. We saw that. But finally, it's becoming more and more news, and hopefully they can cover it. But again, it's not only for this narrow um, patient population, but it's more for the broad population, like anyone with a BMI of 30 or a BMI of 27 with a chronic problem, which are the FDA indications anyway. Hopefully they can say, yes, it's going to be covered. But it's something, it's a little stepping stone,
Dr.
I would say.
Gamboa, I'm seeing all these ads out there that you can order online. I am telling you, that is the worst way not to be under a doctor's supervision. I mean, you can't just give yourself the injection. I mean, I am so glad that my doctor has walked me through all this. And I think you really should have a local doctor if you go on this.
Yes, you definitely need a professional guidance because, like, unfortunately, this is not one of the medications that you can get out from a vending machine, even though they're
Yeah,
trying to do it like that. But it's not it because, like, the patients sometimes don't realize the adverse effects they're having and they continue. Let's say if it's in a vending machine and you want 1 month you buy the 0.25, the next month you go up to the zero point 0.5 like that, but you're not realizing that, oh hey, I'm having some constipation or I'm having some nausea, and you keep going up in the dose, then you end up in the hospital because then you can
that's
end
right.
up with an obstruction. You can have like impaction. You can have like severe like dehydration from the nausea or vomiting. So many things that can go wrong, and that's why a lot of patients are having adverse effects because they're not being monitored appropriately. They're just buying it online. Some people that they're not trained on GLP-1s or the management of these medications are giving it to them because you can find GLP-1s now anywhere, hair salons, anywhere.
Right.
The mall
Do you have a lot of your patients on it?
on the GLP-1s, oh yes, like I have like because my practice also has a lot of like diabetic population.
Yes.
I have so many patients that they have in any different. I have in the oral ones, I have in the injectable ones, I have in the newer ones. So I have in any of the GLP-1s, like, and then I also have the patients that are only for weight loss. They also have the different injections that they are approved.
How are the oral ones doing?
Like the oral ones for the population that works, it's great because basically it's like it's Ozempic, which Ozempic is the brand name. It's semaglutide but oral, so that's called Rybelsus for the diabetics. So the only thing that the patients have to do is to take it 30 minutes on an empty stomach, wait for 30 minutes, and then you can eat. So that's the only requirement. So it's not for everyone because some patients, they may have thyroid medication. So it becomes more complicated whenever they have a thyroid medication that they also has to be on an empty stomach. So we always have to see where the patient is and what medications they have. Also, like it depends on the patient. If they are like very afraid of needles, then we can try the oral one. So we
Yes.
can be with the patient and then see what works. But the oral ones work great. Like I have one patient that she was not even able to go to the highest level, and she lost like 50 pounds on the mid dose of
Wow.
the oral Rybelsus. So it depends on the patient, but it works as good.
Dr. Gambo, I tell you what's so amazing. Well, first of all, the weight loss is the most amazing. But I got to tell you, because I have major kidney problems.
Mhm.
And I got to tell you, the last 2 months, my blood work is so much
Better.
better
Yeah.
that it's not just weight loss.
It's night and day. You're going to notice that because not only your kidney function is going to improve, your liver function is going to be better because guess what? Fatty liver, which is one of the
Right.
most dangerous things and number one in liver transplant now that it surpassed the alcoholic cirrhosis. Now we can have cirrhosis from the fat, then from the liver. Then it helps you with your fatty liver because not only weight loss, but it also helps with decreasing the inflammation of that. Then it helps with obstructive sleep apnea. A lot of patients stop using their CPAP because they don't need it anymore. You know, a lot of patients, they stop taking their blood pressure medications because their blood pressure is normal now and they
Right.
don't need it, you know. So that's the amazing part of this. It helps you.
That's what I've noticed. My blood pressure is down.
Is down, yes, and then
It's
also their knee
it's
pain.
it's so amazing. I want to read this. We just got a text, and we've kind of talked about this, but it's such a nice text. Barbara in North Dallas, Dr. Gamboa, I love your show. I never miss one because I always learn something new each time. Can you explain these injections that were originally supposed to take care of diabetes? I know there are several, and how do they work? I know, which one do you like to use, Dr. Gamboa?
You know what? Like I love every one of them because each one of them have like their benefits, you know? Like so for example, like and I like it's like technology, you know, like whenever you had your iPhone 6, then came the 7, the 8, the 9. So it's very similar with this because they came the first ones that it was like once a day the injection that was Victoza. Then they came up like the once a week that it was like the semaglutide. Then it comes like the other one too, like Trulicity, that's from the competitor of the Ozempic. Then it comes like the one that is two peptides instead of one. So it goes advancing, but as it goes, then you also see the benefits. So to answer your question, Barbara, so is these medications, they work. Believe it or not, they started like I guess I'm gonna go all the way down to like how they came up with. There's a lizard. I believe like that's how like they came up with this substance that they came up. They took it from this lizard. So they found out that this substance stimulates one of the receptors of the GLP-1 that we normally have in our gut. And then that one suppresses our appetite and increases our satiety, among others, that they are going to work at the level of the pancreas, they're going to work at the level of the liver. So many other things. And that's how they mainly work by regulating the insulin. So every time we eat, our insulin goes up. So this one regulates that. That's why it's also suitable for patients that do not have diabetes. And that's why it doesn't cause hypoglycemia, you know. So that's why they found out that people that never had any diabetes, no diabetes or pre-diabetes, they can also use these medications only for weight loss because the way it works. So, and then the older ones, for example, semaglutide has been in the market since 2017. That one has more studies and more time in the market. So, like we find out that that's the one that decreases the risk for cardiovascular disease, decreases the risk for strokes. So that's why the Wegovy has those indications too. Like they only mostly did for the stroke with the Wegovy. So that's how like the benefits they have. Then the newer one, the Monjaro, is two peptides. It helps you, yes, with the GLP-1, but also the GIP. And this GIP peptide also helps a lot with the insulin resistance. So that's why this newer version is a tiny bit more with the weight loss than the previous one. Again, with the comparison of iPhone 7 versus 10. You know, they're still iPhones, but 10 is a little bit more like bells and whistles than the 7. So similar to that.
What is that one called?
It's Monjaro for the
Majaro.
diabetics and Zepbound for the weight loss. But it's a terzepatide.
We just got okay. I want to get this in. We got a text. He said, I've written this twice and you never answered me, but I think we have. This is from Kyle and Garland. He
Tell me.
says, how do I know if I'm low on testosterone?
Very easy, Kyle. We have to do a test. You have to check your testosterone levels, and not only the testosterone, but we have to check also your sex hormone binding globulin because the sex hormone binding globulin, I don't know how old you are, but as we get older, the sex hormone binding globulin also goes up. And then as it goes up, the sex hormone binding globulin traps the testosterone. So even though you have a good level of the total testosterone, but the free testosterone is less because it's trapped by the sex hormone binding globulin. Also depends on medications that you're taking, that they can increase the sex hormone binding globulins, like anti-seizure medications. Those are increased then significantly. In females, it can be increased by the birth control pills. So many things can increase this. And then we have to check those levels. And then also your PSA, that's the prostate, because what happens is, like, if your testosterone was too low, then it's possible that the PSA is going to increase a little bit after we replace it, because the PSA has what we call, there's like the theory of like saturation. So it has so many receptors that it can only absorb. It's like a sponge. It can only absorb so much water, so to speak, so much testosterone. After that limit, it cannot continue to absorb more testosterone. So let's say, and that limit is being shown around 350. So if your testosterone levels are less than 350 and your PSA was 1, so if I give you testosterone, it may increase up to, like, it's saturated at 350, and then it will not go higher. Because, nowadays the myth of testosterone is going to give you prostate cancer is not existent. Basically, now we think the opposite can happen. Whenever your testosterone levels are too low, your risk for prostate cancer increases. So now we're looking into,
I was amazed that you can be young and have low testosterone.
And we are seeing this more and more in young people because of their eating habits. There's like chemicals in the food. There's like all these processed foods, less omega-3/6 in the diet. So many things that can make your testosterone levels go down. Obesity is going to also cause this, the testosterone levels to be low. So many things that we're seeing now in younger people.
How are those pellets doing? Are people having good success with them?
Yes, like the pellets, what I love about the pellets is that it gives you like a very consistent levels. You don't have ups and downs, and it's bioidentical hormone. It's like bioidentical, as we mentioned before. It says that it means that the chemical structure of the hormone that I'm going to put inside you is exactly it's identical to the one that we have. So our body doesn't sense it as foreigner, so it's not synthetic. So that's what is very important, not to have no synthetic hormones in our body. It doesn't matter if it's a cream or a pill, no synthetics, because your body doesn't do well with synthetic.
You know what I hate about your show? It just goes by so fast.
I know.
I'm just looking at Rebel Sound. Tell people how they can reach you starting in January.
Sure. It's like Elite Care Clinic in Las Colinas, and it's the phone number is 469-947-6020. I'm Dr. Gamboa.
You'll be back again with us next month. We always look so forward. Have a wonderful Thanksgiving.
Thank you. You too, Stephen. Like everyone else too. Thank you so much for watching. And
we love you, Dr. Gamboa.
Thank you.
Thank you.
Bye-bye.
That's Dr. Daniela Gamboa. She is an incredible doctor. Mostly deals with women, but she does see men also. Hey, that's it for us today. Everybody have a happy and merry and blessed Thanksgiving. You too, Rebel, our favorite producer. We'll be back again next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Experts show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.